Hello and welcome to a special interview for The Wire. As the world waits a year and perhaps longer for a vaccine, one of the most respected voices in public health has suggested in a paper that maybe the time has come to seriously consider herd immunity as a strategy for battling COVID-19. Joining me now to speak about his paper is Emeritus Professor in Public Health from the University of Edinburgh in Scotland, Raj Bhopal. Professor Bhopal, I want to talk about your recent paper and the best way of responding to the COVID-19 crisis. And then separately, I want to talk to you whether that strategy is applicable in India or perhaps unwise. But let me begin by quoting how you start your article. You say, the COVID-19 pandemic has placed us in a zugzwang. Now that's a chess down. So can you begin by explaining to the audience precisely what it means and why you think it applies to COVID-19?
Well, a zugzwang is a position in chess where every move is a bad move. So if you want to survive in that game and stay in the game and take your chances later on, you have to consider every possible plan, every single move. Then you have to choose a plan with a number of moves in advance thought through and see how you get on. And if you don't get on, you try another plan. That's what happens in a zugzwang. Otherwise, you might as well resign. So I think that is exactly the position we are in.
In other words, we have to find what would be the least worst of the alternatives available to us. And we have to calculate which it is.
In my paper, which I believe is probably the most comprehensive analysis from a public health perspective of this pandemic, I have considered everything. And I've consulted about 20 professional colleagues while writing this paper, and all their thoughts are incorporated as well. So everything is there. In table 1 of my paper, which is open access, anyone can read it, and is written in an accessible language. In table 1, I set out the entire public health strategy. And I also consider what would happen if we did nothing, just let the pandemic unfold. I consider the possibility that the pandemic might just disappear spontaneously. So I consider everything, including everything we do in medicine and everything we do in public health.
Absolutely.
And
And in your paper, you say that until a reliable vaccine is produced, herd immunity, which in fact you prefer to call population immunity, is the only long-term solution. Can you briefly, for an audience that isn't familiar with your paper, explain the thinking that brings you to the conclusion that herd immunity or population immunity is the only long-term solution in the absence of a vaccine?
Yes, of course. Well, let me just start by saying the technical term we use in public health and epidemiology is herd immunity, but that evokes an image of cattle or other kinds of animals, which it doesn't sit well with people, including myself. So I'm suggesting we start using the phrase population immunity. The way population immunity works is that if a proportion of the population has already had the infection or they've had the vaccine, the people who have not had it, they're also protected because the virus cannot spread in a population. It just stays where it is. It cannot spread because it has to spread through people who are susceptible to the infection. Now, for some infections like measles, we need 90% of the population to be immunized. Measles is a highly contagious disease. Each person will cause 14 cases. With COVID-19, that's not true. Each person causes about 3 cases if you don't take any measures. But if you take some measures, simple measures like hand hygiene and social distancing, and in some circumstances wearing masks, one person will only give it to one other person. That's what we call an R number, or a reproduction number of 1. Now, in these circumstances where you're maintaining some degree of control over this pandemic, we have 2 ways of getting population immunity. One is a vaccine. The best estimates are that a vaccine may be with us next summer. We don't know what it will cost. We don't know whether it will be safe. And at this point, we don't know whether it will be effective. What we do know is there are quite a lot of side effects from the 3 vaccines that I'm aware of, where preliminary studies have been published in the Lancet. In the Oxford vaccine, 70% of people had side effects. No one died, but they did have side effects like headache, fever, muscle pains. So we might have a vaccine, and I'm praying like everyone else that we have a vaccine, and I will take it. I'm 67, I'm at risk, and I will take the vaccine. If you're a child or a 20-year-old, will you take this vaccine? I don't know if you will. Will parents allow their children to take it? We will not have safety data for children within a year. We will not know its effectiveness, and the disease is incredibly mild in children and young people. This disease affects older people very badly, but it hardly affects young people at all. Deaths are very rare in young people. So we are all praying for a vaccine, but a vaccine's sometime in the future. No vaccine against the coronavirus has yet been created. MERS was a coronavirus, SARS-1 was a coronavirus, and the common cold is a coronavirus. Now, we're working very hard on a vaccine. Let's hope we get it. So that's one strategy. And I know you would like to ask a question before I move on to the next strategy.
And what I wanted to point out is this: because the young will get the disease only very mildly or probably asymptomatically, you believe that one can achieve a measure of population immunity, what we in India are still used to calling herd immunity, by allowing the young to lead as normal a life as possible, with, of course, the precautions of a mask, etc. Is that how you believe we can build up herd immunity levels to a point at which everyone is safe?
That's exactly what I believe. Let me just continue now. We know from history that the only way pandemics stop or epidemics stop is either something happens in nature and the virus or the bacterium becomes avirulent. In other words, it can't cause any disease. And that sometimes happens. Infections sometimes just fizzle out. That's one way. The only other two ways are immunization, which is a modern way, and the other way is for people just to get the disease, and those who get it, mostly they will survive. And once they've survived, they will, if they get the disease again, it will not be nearly as severe, and life goes on in a population. This disease has got a particular characteristic which I've already mentioned. It's not very damaging for the young, but lockdowns are very damaging for the young. By contrast, this disease is quite damaging, but not so very damaging for the old, but lockdowns are not damaging for the old. For myself, lockdowns don't bother me. I live in a nice house, I'm well off. In fact, I've saved a lot of money in the last 4 or 5 months. I've become richer. But what about my children and my grandchildren? For them, they have their education, they have their new careers, they have love lives to build, they have friendships to cultivate, they have a lot to learn.
I understand all of that. Forgive me interrupting you. But the main point you're making is that if you can get the young in sufficient numbers with sufficient safety to begin to lead a normal life, then you can build up a level of immunity, herd immunity, that will protect everyone. What is that level of infection at which you believe herd immunity becomes operational? Some epidemiologists we've spoken to put it as high as 70%. Others have put it as low as 40. What's your hunch? Your paper seems to suggest it's around 50. Is that correct?
Firstly, I've read about, I know the literature on this subject anyway, and I reread it in preparation for writing this paper. I also consulted some colleagues who are more expert than I am. I think my estimate of 40 to 50% was deliberately chosen as an upper estimate, to be conservative. Some epidemiologists, including one from Oxford, has calculated 25%. So it probably lies somewhere between 25 and 50%. So that's a level we need. And how can we get there reasonably quickly? We can get there in the way, the strategy I've suggested. I'd just like to share some statistics with you. We've published these data, so they're not just private. We examined deaths in 0 to 19 years in 8 European countries and 0 to 14 in the USA. And these are the numbers. There are 137 million children of this age group. there were 61 deaths from COVID-19. And we have to bear in mind, this period we've examined up till June is the worst we're ever going to get for COVID-19. This is the worst. We're through the worst in most countries because we've instituted some control measures. 61 deaths from COVID-19 and 137 million children. Let's compare that with 142 deaths from influenza. We don't keep our children indoors, our young people indoors in case they get influenza. 1,404 from unintentional injury. And 17,573 deaths altogether. The deaths from COVID-19 in this age group was 0.34% of the total number of deaths, 3 in 1,000. So I don't think we should be panicking in relation to our children and our young people. We should be panicking a bit in relation to people who are over 70, particularly if they have diseases like diabetes. So I'm trying to suggest a segmented strategy, i.e. different strategies for different age groups.
You make that point very convincingly with the statistics that you just cited. If we don't worry about far larger number of deaths from influenza and flu or other unintended causes, why are we panicking with the death rate of people of the age group you mentioned is so very, very low from COVID? Nonetheless, your paper does stress two particular cautions that are necessary. First, you say we need to ensure that the young, when they're allowed to lead a normal life, do not end up infecting their parents and grandparents, who may not just be elderly, but could also have comorbidities. And secondly, you stress in your paper the need for excellent healthcare so that those young who do get infected are immediately and effectively treated. Those are two essential conditions as well, aren't they?
Absolutely correct. And because currently we're not talking about this topic at all in any country, it's almost been shut down as a topic of conversation. Indeed, I would say the whole topic of conversation around COVID-19 has been completely closed down by most governments. They don't want to talk about it. They think that people will panic. In my experience, people are not panicking. I've had massive support for this paper. I would say 95%. And strangers have written to me. I never knew them. They've written to me to say thank you for talking some sense. And most of the people who think this is complete sense are people who are not in public health and not in science and not in politics. They're just ordinary members of the public. They're more stoic. They're more understanding of what life is really like. My way of thinking about, if I can just finish this point, my way of thinking about this is young people are not very good at listening to the advice of middle-aged politicians. They're going to lead their own lives anyway. We've already seen the protests on the streets of Germany, protests all over the world against lockdowns. Things are just going to get worse. If we change the strategy and we teach our young people, if your parents have got this or your grandparents have got that, you've got to stay your 2 meters away. And we will teach them a different thing to do, which I think they're far more likely to follow because it's more practical and more reasonable for them than just staying in lockdown.
Sweden did attempt something along the lines of what you're talking about, not quite as fully as you would have wished it. Do you think Sweden is an example that this sort of attempt to build up herd immunity by allowing people, particularly the young, to lead a normal life has succeeded? Because I've often seen statistics that cite that Sweden's 3 neighboring Scandinavian countries altogether have less infection and less deaths than Sweden. And the damage to the economy in Sweden doesn't seem to be less. So it's possible that Sweden may have ended up falling between 2 stools, a very high death rate and case rate, and sufficient damage to the economy as well.
I think the Swedish example is a particularly interesting one. Sweden has done better than the UK, that's for sure. It's done at least as well, if not better, than Scotland, where we've had the most severe shutdown just about in the world. We've been in shutdown since 23rd of March. A few things have been relaxed, but I would say most things have not been relaxed yet in Scotland. We haven't done any better than Sweden. Sweden made a mistake, like most countries did. They didn't protect their older people. It was the care homes, the people, very old people, that should have been protected. And few countries did it. We seem to spend more of our time trying to protect the middle classes in the Middle Ages, whereas we should have been protecting the very poor and the very old. So we now know a lot more about this. We've stopped the care home deaths in Scotland. Half of our deaths have occurred in care homes. The average age of people dying from this infection in the UK is about 80. So I'll write the report cards in 2025 and I'll tell you how Sweden has done. But at this point, it doesn't strike me as if Sweden has done very badly. In fact, it's done reasonably well, considering it didn't have a lockdown.
So what you're saying, if I've understood you correctly, and I'm repeating it so that the audience will understand it correctly as well, is that if you are careful in the way in which you allow the young to go out, they take sensible precautions, but nonetheless they lead a life that's as normal as possible. But at the same time, you find an effective way of protecting the elderly and those with comorbidities, then you can build up infection levels to the 40-50% required for herd immunity. And when that is achieved, then everyone, regardless of age, will be safe because the virus can no longer transmit itself. That's correct. In a nutshell, isn't it?
That's it. It won't happen overnight, but very shortly the virus will just become extinct. That's correct. Now, if I can just say one thing, there will be some children who have immune disorders or some other disease, and they need protecting. And my view on this is that if most children can get back to school, then some who might need to stay at home, but we'll have the facilities for homeschooling for them. Some might even be sent to boarding school just for a short period. But once their classmates have in a short while, they will get it. Most children get it, they don't even know they've got it. Once they've had it, then they can go back to school because in that classroom they'll be safe. So I'm suggesting a very subtle strategy.
So what you're saying, Professor Bhopal, is a strategy of herd immunity centered around the capacity of the young to withstand the disease, to get back and lead a normal life, whilst to take protective measures for the elderly, for those with comorbidities, but also for those children who have particular problems and need protection. So it's not letting the virus rip through the population. It's actually doing it in a calibrated, measured way with sufficient protection, and it will take time, but nonetheless, in the year that we have before a vaccine, it's a better way of protecting ourselves and society, and yet ensuring the economy continues as well. You're balancing both.
Absolutely correct. But may I just come back to the vaccine? The idea that we might have an effective and safe vaccine in a year is a belief. We may not have a safe and effective vaccine for 2 years, 3 years, 5 years, 10 years, perhaps never. So one friend of mine and a very senior and respected colleague said to me, it's vaccine or bust. Well, I don't believe in going bust. I wouldn't live my own life taking a risk of going bust. I think it's if we get a vaccine, that's wonderful. If we don't get one, we have to learn good ways of living with this virus.
In fact, your strategy is the best solution if we're not going to have a vaccine in a hurry. If this belief, as you correctly call it, that we'll have one in a year turns out to be an illusion, it's even more necessary that we should fall back on the strategy you're outlining, because we have to find a way of living for the next 2-3 years. And we can't live in lockdowns permanently, nor can the economy afford to be shut down. But let me now bring up one other factor, which is connected to herd immunity in the sense that if it's a correct theory, it could speed it up. I'm talking about Dr. Carl Friston of University College London's theory or concept of what's called immunological black matter. He believes that in any society, up to 50% of the population are not susceptible to any infection because of such things as cross-immunity or geographical isolation. Now, if that turns out to be correct, and I'd love to know what you think of it, but if it turns out to be correct, doesn't it suggest that the threshold at which herd immunity or population immunity begins becomes a lot lower than we thought?
Well, that's why some people have said it's 25% for precisely those reasons. I think that the points being made there are absolutely correct. Another point that people are forgetting is that most of your immunity is not to do with antibodies at all. It's to do with the white cells. We have a cellular immunity system, and children seem to have a very strong cellular immunity system. The white cells just gobble up the virus and deal with it, and they don't even need to make antibodies. Most people who are exposed to a pathogenic agent don't get infected. One of my one of the diseases I studied most closely was Legionnaire's disease, which is an aerosolized pneumonia. So the bacillus is aerosolized. It's not coughed onto you. It's actually in the air, wafting around in the air. If you expose 100 people to this bacterium, only 1 in 100 actually gets infected. The other 99 just deal with it. That's true with most diseases. It's going to be true with COVID-19. 50% of the people being not susceptible to clinical disease is an underestimate, because we already know that most people are asymptomatic, or 40 to 50%. 40% of people are asymptomatic. Another good proportion get very mild infection. It hardly troubles them. There's a small proportion of the people who get seriously sick, and an even smaller proportion who die. We've now examined the data and we submitted it to the Lancet for potential publication. 7 European countries, the worst phase of the pandemic we'll ever see, i.e. in this period we've just been through, 1% of 80-year-olds in the UK have died from COVID-19, 1%. It's just under 1% for females and just over 1% for males. That's the worst in Europe. In other countries, it's about 0.5%. Now we're panicking about a disease which is causing that level of infection. 80-year-old plus die from other causes much more. This is in the last few months. Far more deaths have occurred from other causes. And we already know from lockdowns in hospitals, people with cancer are not getting the treatment they need. They're going to die. People with strokes, heart attacks, they're not getting the treatment they need.
You're making, once again, with statistics, a very convincing point that if only 1% of people who got COVID over the age of 80 died, then the message and the impression that has spread through the world is a mistaken one. And in fact, you make that point in your article. You say this pandemic is complex, while the message being given to the public is overly simplistic. And that's why you believe adults need to sit down and debate and discuss in a mature way, because you're confident that when that happens, they will begin all to converge around your belief that we can't stay in lockdown forever. If there's no vaccine for a year or 2 or 3, then we have to find a solution, and that solution is to build herd immunity with the necessary precautions we've discussed. And you're confident that when adults maturely with information debate and discuss this, they will come to your conclusion.
I'm just going to correct one thing because I don't want to mislead people. What I said was that in Europe, far less than 1% of the population over 80 have died from COVID-19. That's in the entire population. Not most of the population don't get COVID-19. So as a cause of death in people over 80, it's not a big cause of death. The risk of death in the last 3 or 4 months has been about 1% in England, far less in Germany, far less in France, far less in most other European countries. The UK has got just about the highest. So if you take if 100 people over 80 got COVID-19, a higher proportion of them would die, but most of them are not going to get it. But even then, we're probably talking about 13% dying, 87% surviving. Absolutely. If 100, so it's not a killer. It's not quite the way it's portrayed. The way it's portrayed is through the media. The media focuses on the disasters, a child that dies. They don't focus on the 999 children who didn't die. So we have to get this in perspective. And statistics.
Chris Charles, who said the media focuses on the one plane crash that happens, they never talk about the millions of planes that successfully take off and land. And that's a very good point that you're making. But let me just sum up that point like this. There's no doubt that of the total COVID deaths, those over 60 or 70 or 80 are disproportionately large. But as you said, if you look at the total population in the UK of people over 80, less than 1% of them have died. And it's important to look at it in the second rather than just in the first sense. And I think you make, therefore, a very convincing case, particularly for Western countries, to experiment with and to go down the path of herd immunity, particularly if we're not going to have a virus for a vaccine for 2 or 3 years. But I'm going to take a break and come back and ask, does this logic work for India as well? Or are there particular circumstances in India which don't exist in the West, which might make it very dangerous, perhaps even risky, to attempt herd immunity in this country? We'll be back in a moment's time after this break. Welcome back for a special interview for The Wire. My guest is one of the world's greatest experts on public health, Emeritus Professor of Public Health at the University of Edinburgh in Scotland, Raj Bhopal. Professor Bhopal, let's now come to India, a country that you know intimately, despite the fact you actually work in Edinburgh. It has, as you know, a very young population. 90% are under 60, 81% are under 50. So prima facie, does the herd immunity, better known as population immunity strategy, make sense for this demographic?
As I said earlier, the young have got a great deal to lose from lockdowns and other measures taken to try and stamp down on this pandemic. And they don't have a great deal to lose from getting the infection itself. When we get a vaccine, it may or may not work in the young, but the side effects of the vaccine may be considerable, and it will take us time to show that this vaccine is safer in young people than getting the infection itself. So it's going to be a while before we're sure about that in younger people. Now, in countries like India, and India is not the only one, much of Africa, people are very young. On average, it seems to me that in countries that are trying to build up economically, they can't afford to have everyone in lockdown, especially the young people. In a country like India, where most people live in overcrowded households, even in the villages, not just in the cities, and many people are homeless and they're living in the railway stations or under bridges, it's not really possible to apply the kind of strategies that are being applied, for example, in the UK. And even the kind of strategies that the WHO is advocating. May I say, I respect the WHO hugely. I'm a big fan of the WHO, and I've read all their strategies and I try and follow their guidelines. But I cannot see how this kind of thinking can work in a country like India, not just India, but many other countries like it. Now, for a country like India, we have a substantial number of people with type 2 diabetes and other comorbidities of that kind. Heart disease is quite common. Being overweight and obese is common in the cities. It's less common in the villages. And there are a lot of people at high risk. People have worried about other comorbidities like malaria or TB. I would say those are less worrying than the comorbidities to do with type 2 diabetes, heart disease, and being overweight. So there are people who are at high risk, and a lot of attention needs to be paid to them to minimize the effects on them.
Can I stop you? I'll come to those in a moment's time. But first, given the demographics of this country, are you suggesting that the herd immunity, population immunity strategy is the right one? Can you give me a clear answer on that?
You know, these are complex matters, and they need to be discussed by the government, public health people, and the public itself. The public itself needs to be consulted, which is not, people have not been consulting the public, that's for sure. Public have been told what to do in no uncertain terms. They've been forced to do things by law, things they wouldn't otherwise do if they weren't made illegal, with large fines and people being locked up. So the public needs to be consulted. But to get to the core of what you're asking me, yes, I've already said to my children, the best thing for you is just to get it over and done with, because the pandemic might be back in a far more virulent form. And I'm worried in case it comes back in a form which affects children. Currently it's not. But, you know, viruses evolve. currently they don't have the key to the lock to get into the cells of young
I'm
children.
interrupting you yet again. But when you say yes, are you saying yes to the application of herd immunity or population immunity to India? Because your
Yes,
children,
I
when
am.
you spoke about them, are actually with you in Scotland. So let me just get
Yes, I
a
am.
precise answer. Would you say, if you were asked for your advice by Mr. Modi, if he picked up the phone and rang you up and said, Professor Bhopal, I've read your paper, I've seen your interview, are you advocating that I should follow the same population immunity, herd immunity strategy in India? Would you say yes? Would you say no?
Personally, I would say there's no other option for India. You don't have the healthcare systems. You don't have free healthcare for everyone in the country. That's your only option. There's no other option for India that I can see. And yes, I think you have a lot of young people, they'll survive it. A few will die, but people have to be told that there is some risk even to young people. It's not completely risk-free, but probably the risk of this virus in people, I've already explained, is less than getting influenza. So less than getting TB. So we don't lock down countries because of other diseases. And I would say to Prime Minister Modi, let the young people get on with their lives in a controlled way. Teach them very carefully how to look after themselves. People need to come forward. If they get the disease, it's a lot better if they come forward. We don't want it to go underground. We don't want it to be clandestine. Because what happens then is that people don't come forwards and they're passing it on in an uncontrolled way.
Okay.
And they're fearful of what will happen to them.
You've given
So
a
yes,
very
go,
clear
go.
answer. And if Mr. Modi is watching the interview, he'll know precisely what your advice is. Let me put to you some of the downside risks. To begin with, as you know, Indians live in multi-generation households. Often 2 to 3 generations live together. More importantly, they live in very small accommodations. One room, sometimes 2 rooms. In those circumstances, how do you ensure that the young don't infect their parents and grandparents? It's impossible to separate them. You can do that in Europe where you have larger houses or where families don't live multi-generationally. But in India, where they do and they live in small accommodation, how do you ensure the elderly aren't infected?
Well, can I just say for myself, I have not touched my grandchildren or my children. Two of my children are staying with me at the moment, and I have not touched them. And in our own house, we observe 2 meter rule in our own house. When we're outside, we observe the 1 meter rule with my children. And it's inside the house that masks are important, not outside. If you want to avoid infection occurring inside in houses, wear the mask in the houses. I know it's not easy. Parents, grandparents, children need to learn from each other, no touching. I think you can maybe touch your very young grandchildren. They're much less likely to pass it on. And even within a small household, I may say I was brought up in a very small household and I was born in a very small house. So I know what houses are like in India. That is particularly important that all the hygiene measures
Can I,
are
can I
taken
put this to you?
inside the house. You're
Can I
not
put
going to
this
get
to
it on
you?
the streets.
What about the tens or hundreds of millions, I emphasize hundreds of millions of Indians who live in what are called jhuggi jhopri colonies, in slums, in tenements, where 8 or 9 people live in a single room of 3 generations together? How do you ensure that the young who go out and work and earn, when they come back in the evening, don't infect their parents and grandparents? And much the same would happen in villages too. How do you ensure that the elderly aren't infected by their young?
Well, the answer is you can't. And we already know that in Dharavi, I've read somewhere that in Dharavi, 50–60% of people have got antibodies. I don't know if that's correct. You might have read a different number.
It
If
is.
that is correct, then effectively Dharavi is entirely, everyone in Dharavi has had the infection virtually. And that's a reality. And sometimes we just have to live with realities. And what can we do about it?
Let me
That's going to happen.
let me put a second downside risk to you. As you said, when the young go out to work, and even if they do so with all the sensible precautions, a fair number will fall in, a fair number will be affected. We are hoping that it will be asymptomatic and it will not be serious, even if it's just mild. But if a large number of young in India were to get infected and fall ill, can the Indian healthcare system take care of them? Clearly, in Britain and Europe, your healthcare systems can. But what about the Indian one? In metropolitan cities, it's struggling to cope with large numbers when that was the case in June and the middle of July. But in village India, healthcare doesn't even exist as such. And if tens of millions require hospitalization, then what happens?
May I just re-emphasize the point in my paper that a large number of measures have to be maintained. I'm not saying that we dispense of, I'm completely against the letting it rip policy. And a large number of measures, more than we've currently been doing, need to be maintained. I've already mentioned something that no one is really emphasizing. You're not going to be infected in the street. I mean, if you went to the Kumbh Mela, you might be, but in a normal street where there's a bit of air and wind, you're not going to be infected there. You're going to be infected in your own home or in your neighbor's home or in a friend's home or in the mosque or in the temple or the Gurdwara, in the workplace. Though inside, that's where you're going to get infected. You're not going to get infected in the fields. If you're laboring on a road, you're not going to get infected there. You're going to get it from people. So you have to institute the basic hygiene and precautionary measures that we've emphasized time and time again. And this is like a bottle of champagne. But I'll just finish this analogy. It's like a bottle of champagne where you've taken off the cork. You don't want all the gas to explode out of that champagne. You have to keep your thumb on it. So it's released, the gas is released in a very controlled way. I'm not saying this is not it's not a laissez-faire policy. It's a thought-out, controlled way. At least discuss it.
Absolutely. What I'm pointing out is something slightly different. As you emphasized in your article, when the young are sent out to work in European or American countries, you have to make sure that you have sufficient good quality healthcare, both to look after them if they fall ill or to isolate them if necessary. Those amenities and facilities may not exist in sufficient number in India, and they probably do not exist in rural India. Yet if even a small percentage of the young in India as a result of herd immunity were to fall ill, you'd be talking of tens of millions of people. Remember, the population is 1.38 billion. So even a small fraction falling ill could be tens of millions. What happens if you don't have the healthcare? What happens if you don't have hospital beds? Can you risk it in India?
Can I just say I've been following the Indian healthcare system since 1977, when I spent 8 weeks in India with the All India Institute of Medical Sciences. And ever since then, I've taken a strong interest in how the Indian healthcare system works, not least because of seeing how my in-laws were treated in Indian hospitals. The Indian healthcare system needs to be completely overhauled from top to bottom, and this is the opportunity to do it. This idea that they can have super rich hospitals for very few people and absolutely appalling facilities for hundreds of millions of people is shocking. And this is the time for Prime Minister Modi and the government to say, we're going to institute a proper public healthcare system.
Professor Bhopal, no one would disagree that the Indian healthcare system needs to be overhauled from top to bottom. No one would disagree that the government needs to put a lot more money into healthcare than they do at the moment. It's just fractionally above 1% of GDP. It needs to be much, much more. But you can't do it in time to produce results for a year or two. And the danger is that the advocacy of herd immunity or population immunity could mean large numbers falling ill in the next few weeks and months.
Can I just say,
capacity to handle that? Or would you say that this is one reason why perhaps you'd have second thoughts about applying herd immunity to India?
I'm not saying anything about blind herd immunity. I'm saying very controlled approach to accepting that a lot of young people might get the infection, which they're getting anyway. If you look at the Indian statistics, if you said how many cases are there in India, why don't you try multiplying them by 10 to get a true sense of how many cases there have been? And if you look at the number of deaths, you might have to multiply them by 3, 4, 5 times just to get a true sense of what is actually happening in India as opposed to the reported numbers of diagnoses or reported number of deaths. I think you'll find that actually the situation is far worse than is being reported currently.
Without doubt.
And
Without doubt.
then you'll find probably
of Harvard told us just 3 weeks ago that in fact by the end of September, the total number of cases in India could be as much as 200 million, both those officially reported as well as those not detected. And the Massachusetts Institute of Technology has predicted that if there's no vaccine, then by February, March of next year, India could be increasing by 280,000 per day. So all of that is known. I'm just simply saying one little thing. Are you confident that if the approach you're suggesting is attempted, A, we can do enough to protect the elderly, even though our living conditions are so different to yours, and B, we have enough facilities to ensure that those young people who fall ill recover? Or are you saying we can't take adequate measures, but there's no alternative nonetheless?
If people are not willing to talk about it and discuss it and think through strategies to make it happen, then we're heading for a disaster, because all those hundreds of millions of cases that are occurring in India or are about to occur, if they occur in a random fashion, it's a disaster. If they occur in a more controlled fashion, it's less of a disaster. So we're in a zugzwang. We want the least disaster possible. The least disaster for the maximum benefit for the people and the economy means protecting the old, protecting the vulnerable, allowing younger people who've got a lot to lose from lockdowns try to get on with their lives as best as possible. While you redevelop the healthcare system, you could start by saying all private beds are now open for COVID-19 care, and the government will pay for that. So that would be a good start. Then you would release up a lot of beds. Other countries have had to do exactly the same thing. We've had to build the Nightingale hospitals. We put them up in 2 weeks, 1,000 beds, 2,000 beds, all across the country. India can do that.
We've done that as well. 10,000 bed hospitals have been put up in Delhi by the Delhi government. They've been put up in Bombay. They're being put up in Pune. That has happened. Let me end, because we're coming to the end of this interview, by asking you this. Are you hoping that both parts of this interview, part one where you explained the theory or the logic behind herd immunity or population immunity, in part two where we're talking about applying it to India, will spark a debate, will make people sit up and discuss the idea so that society is better informed and can take an informed decision? Is that what you're hoping will be the outcome?
As you know from my paper, one of my most strongest recommendations, in fact, is a final recommendation. The time has come for an open, honest, and public debate where people are told the truth. And the truth is, we're in a terribly bad situation, which we cannot control, even in countries like Scotland. Currently, Aberdeen is in lockdown. A couple of weeks ago, Dumfries and Galloway was in lockdown. We lifted the lockdown and we reimposed it. We cannot control it here. Globally, we can see what's happening in Africa. We can see what's happening in Latin America. The United States has been unable to control it. At some point, we have to start to accept the facts and say, how do we deal with it given these facts? And the public needs to know the facts. There's far too much optimism, false optimism in the air, whether it's hydroxychloroquine works or whether the vaccine will be here by October. These are the kind of things we're hearing all the time, and the public is being misled. And in the public health fraternity to which I belong, that kind of optimism just isn't there. Amongst the people who really know about infections, epidemics, and pandemics, I'm not hearing any optimism. The only thing I'm hearing is praying and hoping, but there isn't any optimism. So we need to tell the people the truth.
You made a very good point. Not only do we need to tell the people the truth, but we also need to point out to them that world over, not just in India, in, as you said, parts of Scotland, in America, God forbid, pretty soon in Africa, this disease will not be within our control. And we can't keep living in the illusion or the hope that a vaccine is around the corner. It may not be there for 2 or 3 years. We therefore have to, as you said, learn to find a way of controlling it, learn to find a way of living alongside it. And the approach of herd immunity or population immunity is the only one that allows us to do this and also allow the economy to continue, because livelihoods particularly in poor countries, are often as important as lives. There's no use living if you're starving at the same time. But let me end
Exactly.
by putting one thing to you, because I'd love to get your opinion on it. The Indian government repeatedly, and when I say repeatedly, probably every second day, stresses one statistic alone because they believe it is reassuring, they believe it shows to the world and to the Indian people that India is behaving differently to the rest of the world. That is our mortality rate. Now I've checked. As of this morning, the 7th of August, it's 30 per million compared to 683 in the UK, 610 in Spain, Italy's 582. Now, I know you can question the accuracy of the mortality rate in India, and many people do. And I also know that it's not wise to compare mortality rates between countries because their age demographics are very different. But that said and done, the government still says there's a huge difference between 30 per million and 683 per million. And the government claims this suggests we're doing better than the rest of the world. And a lot of people get assurance from that claim. How would you respond to that claim?
I think is roughly what I would expect. For the mortality for this disease doubles with every 7 years of age. So if you've got a population on average where the population is, let's say, 21 years of age, and somewhere else you've got a population which is on average 45 years of age, then you would expect something like 8 times more, an eighth of the death, or there's the number 2 times 2 times 2, an eighth of the death rate. So, and then we know there'll be an undercount of deaths in India. So, but by and large, it's very age dependent. So younger populations are going to have far fewer deaths. That's the point I've emphasized. And I've also emphasized, not just in this paper, but in many other writings and interviews I've given, that the only way to analyze these data is to break them down by age and sex. So men have about twice as much death rates as women. Maybe not quite as much, maybe about 1.5 times as much, depending on the age. And the age group effects are so stark that unless you start to examine the data by 10-year age groups, for males and females separately, you don't really understand what is going on.
Absolutely.
But taking the undercounts, I think it's true that even if everyone in India got this infection, everyone will not get it, but let's say half the population got it. Once half the population gets it, the whole thing will just fizzle out. Then even if everyone did, the death rate will still be low in India because the average age of the population is low.
And that's the important point, isn't it, Professor Bhopal, that the real explanation why India's death rate is so low is because the population is so young. As I said at the beginning, 90% are under 60, 81% are under 50. So even if they get it, it will be very mild. It certainly won't be a killer. And that brings us back to the core logic behind your argument for herd or population immunity for India. We have a young population. They can afford to take the risk with masks on of getting the disease because it will be mild, maybe even asymptomatic, and they can help build immunity levels to a point at which the rest of the country, those who are elderly, those who have comorbidities, are also safe. This statistic.
Yes. If I can just I did need to come back on a couple of points before we complete this interview. Firstly, I think it's true to say that under 25, it is quite a mild infection. Once you get above 25, it is not mild. It's like a bad flu. It's not mild after that. It is not a serious killer. Once you get over 60, it becomes a serious killer. And even then, I've tried to explain by serious killer, I mean mortality rates of 3, 4, 5% if you get it.
Absolutely.
So I don't want to underplay it. Underplaying it would be wrong, but we have to balance up what this infection really is doing to us from a health point of view compared with what lockdowns and other measures are doing to us, both from an economic and from a health point of view. The single most important thing for good health is wealth. And if we destroy our wealth base, we destroy our health base. So we have to look at both things.
You cannot afford a strategy that will cripple the economy, because even if you then survive the health crisis, you'll have nothing to live for. And I think you've made that point very tellingly. We'll end there. But I'll repeat for the sake of the audience that when I asked you, do you believe herd immunity, or what you prefer to call population immunity, is the right strategy for India to follow? If Mr. Modi were to bring you to ask for your advice, your answer was, there is no other option for India. I hope.
Well, maybe I don't want to be too categorical. What I've said in my paper is this has to be a component of a comprehensive public health strategy.
Yes, but it's a critical component, and it needs to be undertaken with all the necessary cautions, both to protect the young as well as to protect the elderly. But the important point is, if you're not going to have a vaccine for 2-3 years, no country can afford to live in lockdown till then, particularly not poor countries, and they need to get back to work. They need their livelihoods to continue. This is the only way of doing it. I thank you for taking time for us. I thank you for this interview. Take care, Professor Bhopal. Stay safe.
Thank you very much. Thank you. It's been a pleasure. Thank you. Bye-bye.
To receive instant updates on all videos from The Wire, click the subscribe button and hit the bell icon. Pay to support independent journalism. Click the link in the description and choose the amount you want to pay.